AMCA Competency Questions, 154 questions with explained answers. Question 1. Which is an example of a recommended preventive procedure? Option A. Eating the recommended daily allowances. Option B. Teeth whitening. Option C. Childhood immunizations. Option D. Daily exercise. The correct answer is option C. Childhood immunizations. Explanation. Childhood immunizations are preventive because they reduce the risk of developing specific infectious diseases before illness occurs. Question 2. The function of the platelet is to: Option A. Cause the blood to clot. Option B. Fight infection. Option C. Carry oxygen. Option D. Carry nutrients. The correct answer is option A. Cause the blood to clot. Explanation. Platelets are essential for primary hemostasis because they adhere to damaged blood vessels, aggregate, and help form the initial platelet plug. Question 3. Most exposures to human immunodeficiency virus in healthcare settings are the result of: Option A. Contact with acquired immunodeficiency syndrome patients. Option B. Splashes during surgery. Option C. Accidental needle sticks. Option D. Tainted blood transfusions. The correct answer is option C. Accidental needle sticks. Explanation. Needle stick injuries are a major occupational route of exposure to bloodborne pathogens because contaminated sharps can introduce infected blood directly through the skin. Question 4. The way to organize appointment scheduling so that it best supports the success of the practice is to: Option A. Include a lot of time physician's administrative activities. Option B. Allow frequent breaks. Option C. Consider the preferences of the physician. Option D. Schedule as many patients as possible throughout the entire day. The correct answer is option C. Consider the preferences of the physician. Explanation. Considering the physician's working preferences helps create a realistic schedule that supports workflow, patient access, and the way the practice is actually run. Question 5. Another name for chest leads is: Option A. Standard. Option B. Precordial. Option C. Limb. Option D. Augmented. The correct answer is option B. Precordial. Explanation. Precordial leads are the chest leads placed across the front of the chest to view electrical activity from different horizontal angles. Question 6. A physician, specialist, or any person that provides medical care is known as the: Option A. Provider. Option B. Policyholder. Option C. Subscriber. Option D. Dependent. The correct answer is option A. Provider. Explanation. A provider is a healthcare professional or organization that supplies medical services to patients. Question 7. When using a number 10 envelope, where should the address be placed? Option A. 10 lines down from the top and 4 inches from the left edge of the envelope. Option B. 14 lines down from the top and 2 inches from the left edge of the envelope. Option C. 10 lines down from the top and 2 inches from the left edge of the envelope. Option D. 14 lines down from the top and 4 inches from the left edge of the envelope. The correct answer is option C. 10 lines down from the top and 2 inches from the left edge of the envelope. Explanation. The keyed placement centers the delivery address in the standard address area of a number 10 envelope so automated postal equipment can read it properly. Question 8. Which mode of infection transmission occurs from touching contaminated linens? Option A. Droplet contact. Option B. Direct contact. Option C. Vehicle contact. Option D. Indirect contact. The correct answer is option D. Indirect contact. Explanation. Contaminated linens act as an intermediate object, so transmission from touching them is classified as indirect contact rather than direct person-to-person contact. Question 9. While Mr. Dillon's hematocrit is spinning in the centrifuge, you perform an automated hemoglobin test on a sample of his blood and record the value as 15 grams per deciliter. You do a quick mental calculation and expect that the hematocrit value will be approximately: Option A. 5 grams per deciliter. Option B. 5%. Option C. 45%. Option D. 45 grams per deciliter. The correct answer is option C. 45%. Explanation. A common screening estimate is that hematocrit is about 3 times the hemoglobin value, so a hemoglobin of 15 grams per deciliter suggests a hematocrit near 45%. Question 10. A baby's pulse and respirations are: Option A. The same as adults. Option B. Not significantly different than an adult. Option C. Faster than an adult's. Option D. Slower than an adult's. The correct answer is option C. Faster than an adult's. Explanation. Infants normally have faster heart rates and respiratory rates than adults because of their smaller body size and higher metabolic demand. Question 11. Sinus is a slow dysrhythmia. Option A. Bradycardia. Option B, tachycardia. Option C, rhythm. Option D, dysrhythmia. The correct answer is option A, bradycardia. Explanation. Sinus bradycardia is a sinus rhythm with a slower than expected rate because the sinoatrial node is firing slowly. Question 12. Choose the answer that corresponds with letter B. Option A, brachial artery. Option B, cephalic vein. Option C, ulnar artery. Option D, radial artery. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 13. After obtaining an electrocardiogram tracing, a medical assistant would be expected to: Option A, check the patient with a pulse oximeter to verify accuracy of the electrocardiogram tracing. Option B, evaluate the patient's medication list for cardiac-altering drugs. Option C, instruct the patient on the tracing results and cardiac prognosis. Option D, observe the tracing for quality and decide if another tracing may be required. The correct answer is option D, observe the tracing for quality and decide if another tracing may be required. Explanation. After recording an electrocardiogram, the medical assistant should check the tracing for artifact and technical quality and repeat it when necessary rather than interpret the diagnosis for the patient. Question 14. Which situation would a medical assistant's signature be required? Option A, after the chief complaint is documented. Option B, after the patient gives a medical history account. Option C, on an informed consent document. Option D, when a patient gives implied consent. The correct answer is option C, on an informed consent document. Explanation. An informed consent document requires signatures to show that the consent process was completed and documented according to office policy and legal requirements. Question 15. Which of the following is a standard speed for an electrocardiogram machine? Option A, 50 mm per second. Option B, 100 mm per second. Option C, 10 mm per second. Option D, 25 mm per second. The correct answer is option D, 25 mm per second. Explanation. A standard electrocardiogram paper speed is 25 mm per second, which provides the usual time scale for measuring intervals and rates. Question 16. A provider withdraws from the care of a patient without reasonable notice of discharge is considered: Option A, abandonment. Option B, malpractice. Option C, negligence. Option D, slander. The correct answer is option A, abandonment. Explanation. Abandonment occurs when a provider ends the professional relationship without reasonable notice or without giving the patient a reasonable opportunity to obtain continued care. Question 17. What is the minimum number of electrodes that may be attached to the patient for Holter monitoring? Option A, 12 electrodes. Option B, 2 electrodes. Option C, 5 electrodes. Option D, 10 electrodes. The correct answer is option C, 5 electrodes. Explanation. The source specifies 5 electrodes as the minimum for this Holter monitoring setup. The exact lead configuration can vary by device, so equipment instructions should be followed. Question 18. Which choice is a typical educational for elderly patients to prevent disease? Option A, the location of the patient's public health resources in their community. Option B, health anti-aging skin care techniques and products. Option C, sterile technique used in the medical practice. Option D, annual flu pneumonia vaccination information. The correct answer is option D, annual flu pneumonia vaccination information. Explanation. Vaccination education is an important preventive topic for older adults because immunization can reduce the risk of serious respiratory infections and related complications. Question 19. Every prescription for a controlled substance requires the physician's signature and a number? Option A, Food and Drug Administration. Option B, Drug Enforcement Administration. Option C, Environmental Protection Agency. Option D, Centers for Disease Control and Prevention. The correct answer is option B, Drug Enforcement Administration. Explanation. Controlled substance prescriptions require the prescriber's Drug Enforcement Administration registration number because that agency regulates controlled substances in the United States. Question 20. The best way to handle a difficult or bad patient is to: Option A, threaten to report the patient to his or her doctor. Option B, speak firmly to maintain charge of the situation. Option C, help the patient to feel in control of the situation. Option D, leave the room without collecting the specimen. The correct answer is option C, help the patient to feel in control of the situation. Explanation. Helping an upset patient feel some control can reduce confrontation and improve cooperation while the medical assistant maintains clear professional boundaries and safety. Question 21. If a finger is excessively milked during a skin puncture, the result will be: Option A, a decrease in pain for the patient. Option B, increased venous blood flow to the puncture site. Option C, an adequate of blood for filling several capillary tubes. Option D, hemolysis and contamination of the specimen with tissue fluids. The correct answer is option D, hemolysis and contamination of the specimen with tissue fluids. Explanation: excessive squeezing of a puncture site can damage blood cells and mix tissue fluid with the sample, causing hemolysis and dilution or contamination of the specimen. Question 22. A female patient came into the emergency room due to vaginal bleeding. What is the name of the instrument used to hold open the wall of the vagina? Option A, retractor. Option B, speculum. Option C, hemostat. Option D, forceps. The correct answer is option B, speculum. Explanation: a speculum is used to separate and hold open the vaginal walls so the cervix and vaginal canal can be examined. Question 23. A patient has been taking aspirin for arthritis. Which of the following is most likely to be affected by it? Option A, bleeding time. Option B, glucose time. Option C, blood culture collection. Option D, blood culture results. The correct answer is option A, bleeding time. Explanation: aspirin inhibits platelet function, so it can prolong bleeding time and increase the tendency to bleed. Question 24. Which of the following statements is true under the doctrine of respondeat superior? Option A, the physician is responsible for any errors made by the medical staff. Option B, the person who has been employed for the longest period of time is responsible for any errors made by the medical staff. Option C, the medical administrative assistant is responsible for any errors made by the medical staff. Option D, the medical administrative assistant is superior to other members of the medical staff. The correct answer is now shown. Explanation: the source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 25. A female patient came into the office for her scheduled routine physical. You are measuring the patient's vital signs. Which part of the brain is responsible for the temperature regulation? Option A, hypothalamus. Option B, thalamus. Option C, medulla oblongata. Option D, pons. The correct answer is option A, hypothalamus. Explanation: the hypothalamus helps regulate body temperature by comparing internal temperature signals with the body's set point and triggering heat loss or heat conservation responses. Question 26. This unit in the hospital is run by physicians and experts in the field of musculoskeletal disorders of bones, joints, ligaments and tendons. Identify this department. Option A, rheumatology. Option B, obstetrics. Option C, ophthalmology. Option D, oncology. The correct answer is option A, rheumatology. Explanation: rheumatology focuses on disorders involving joints and connective tissues, including many conditions that affect bones, ligaments, tendons, and surrounding structures. Question 27. The amount of blood pumped by the heart per minute is called: Option A, ejection fraction. Option B, cardiac output. Option C, contractility. Option D, blood pressure. The correct answer is option B, cardiac output. Explanation: cardiac output is the volume of blood the heart pumps in 1 minute and is commonly described as heart rate multiplied by stroke volume. Question 28. Regulation of the heart rate, speed of electrical conduction and strength of contraction are influenced by the brain via the nervous system. Option A, autonomic. Option B, somatic. Option C, core. Option D, voluntary. The correct answer is option A, autonomic. Explanation: the autonomic nervous system regulates involuntary cardiac functions such as heart rate, conduction speed, and force of contraction through sympathetic and parasympathetic influences. Question 29. The 4 symptoms of inflammation are erythema, edema, pain, and Option A, irritation. Option B, vomiting. Option C, heat. Option D, headache. The correct answer is option C, heat. Explanation: the classic local signs of inflammation include redness, swelling, pain, and heat caused by increased blood flow and inflammatory activity in the affected area. Question 30. Mr. Smith is suffering from an enlargement of the bones in the entire skull as well as in the hands and feet, in addition to thickening of the skin. Which of the following conditions is Mr. Smith suffering from? Option A, Addison's. Option B, Cushing's. Option C, acromegaly. Option D, cretinism. The correct answer is option C, acromegaly. Explanation. Acromegaly results from excess growth hormone after the growth plates have closed, producing enlargement of the hands, feet, facial bones, and soft tissues. Question 31. Also known as problem-oriented medical record, is a method of tracking the patient's problems during the time they are receiving medical care. Option A, problem-oriented model records. Option B, problems on medical records. Option C, problem-oriented medical record charting. Option D, prognosis on medical record charting. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 32. What is the name of the heart valve that separates the right atrium and right ventricle and? Option A, aortic valve. Option B, tricuspid valve. Option C, pulmonic valve. Option D, mitral valve. The correct answer is option B, tricuspid valve. Explanation. The tricuspid valve lies between the right atrium and right ventricle and prevents backward flow into the atrium during ventricular contraction. Question 33. A patient came to the clinic for a low-grade fever of 1 month duration. As part of the laboratory workup, the physician ordered erythrocyte sedimentation rate. What color tube would be used for this test? Option A, green top tube. Option B, light blue top tube. Option C, lavender top tube. Option D, red top tube. The correct answer is option C, lavender top tube. Explanation. The source keys a lavender top tube for erythrocyte sedimentation rate testing. Collection requirements can vary by laboratory method, so the laboratory protocol should be followed. Question 34. Aspirin and acetaminophen are examples of. Option A, analgesics and antipyretics. Option B, antitussives and decongestants. Option C, antihistamines and antiemetics. Option D, antidotes and antibiotics. The correct answer is option A, analgesics and antipyretics. Explanation. Aspirin and acetaminophen reduce pain and can lower fever, which makes them analgesic and antipyretic medications. Question 35. What is the appropriate test used for heparin therapy? Option A, point-of-care testing. Option B, activated partial thromboplastin time. Option C, hemoglobin and hematocrit. Option D, serum separator tube. The correct answer is option B, activated partial thromboplastin time. Explanation. Activated partial thromboplastin time is commonly used to evaluate the effect of unfractionated heparin on the blood clotting process. Question 36. Which of the following should be used to chill a specimen as it transported? Option A, a small freezer unit. Option B, frozen blocks of ice. Option C, crushed ice. Option D, tepid water. The correct answer is option C, crushed ice. Explanation. Crushed ice surrounds the specimen closely and provides efficient chilling when a test requires transport at a low temperature. Question 37. The functional unit of the kidney is the. Option A, nephron. Option B, ureter. Option C, urethra. Option D, bladder. The correct answer is option A, nephron. Explanation. The nephron is the microscopic functional unit of the kidney that filters blood and helps form urine. Question 38. The main purpose of personal protective equipment is to. Option A, help project a professional appearance. Option B, protect street clothes from getting soiled. Option C, provide the employee a barrier against infection. Option D, systolic pressure below 90 and diastolic pressure below 60 mm of mercury. The correct answer is option C, provide the employee a barrier against infection. Explanation. Personal protective equipment creates a barrier between the worker and potentially infectious material, reducing exposure to blood, body fluids, droplets, or other hazards. Question 39. Automaticity refers to. Option A, the ability of the myocardial cell to contract when stimulated by an electrical impulse. Option B, the ability to transmit an electrical stimulus from cell to cell throughout the myocardium. Option C, the ability to respond to an electrical stimulus. Option D, the ability of certain myocardial cells to produce an electrical impulse without the need for outside nerve stimulation. The correct answer is option D, the ability of certain myocardial cells to produce an electrical impulse without the need for outside nerve stimulation. Explanation. Automaticity is the ability of certain cardiac cells to generate electrical impulses spontaneously without an external nerve signal. Question 40. A patient has a possible corneal abrasion and needs a referral. Which specialty is a physician that deals with eye injury and disease? Option A, ophthalmologist. Option B, oncologist. Option C, optician. Option D, optometrist. The correct answer is option A, ophthalmologist. Explanation. An ophthalmologist is a physician who diagnoses and treats eye diseases and injuries and can provide medical and surgical eye care. Question 41. A female patient came into the emergency room with her husband. She was suffering from severe shortness of breath. She appeared to be unable to take in sufficient oxygen. What is the color of the skin and nail beds? Option A, brownish. Option B, greenish. Option C, reddish. Option D, bluish. The correct answer is option D, bluish. Explanation. Bluish discoloration of the skin or nail beds can indicate cyanosis, which occurs when the blood contains an increased amount of deoxygenated hemoglobin. Question 42. Notifiable infection must be reported to. Option A, the patient's physician. Option B, your supervisor. Option C, World Health Organization. Option D, Center for Disease Control. The correct answer is option D, Center for Disease Control. Explanation. The source keys the Centers for Disease Control and Prevention. In practice, reporting usually follows state or local public health rules, so this item should be checked against the jurisdiction and course standard being taught. Question 43. A female patient came into the clinic for follow-up after a right-sided mastectomy with some removal of lymphoid tissue. What is the name of the condition that makes blood draw on the right arm not recommended? Option A, syncope. Option B, lymphostasis. Option C, anemia. Option D, hemoconcentration. The correct answer is option B, lymphostasis. Explanation. Lymphostasis means impaired lymph drainage and can occur after lymph node removal, which is why venipuncture is often avoided on the affected side when possible. Question 44. In a standard 12-lead electrocardiogram, the measurement of current that the heart muscle produces between the right arm electrode and left arm electrode is known as the Option A, standard limb lead 3. Option B, augmented lead. Option C, standard limb lead 2. Option D, standard limb lead 1. The correct answer is option D, standard limb lead 1. Explanation. Standard limb lead 1 records the electrical potential difference between the right arm and left arm electrodes. Question 45. The act of listening for sounds made by internal organs to aid in the diagnosis of certain disorders is called Option A, menstruation. Option B, percussion. Option C, auscultation. Option D, palpation. The correct answer is option C, auscultation. Explanation. Auscultation means listening to internal body sounds, usually with a stethoscope, such as heart, lung, and bowel sounds. Question 46. You are to draw the blood of a patient. After reviewing the lab order, you realize that you need to draw a complete blood count with differential on your patient. Knowing that this test is drawn in a lavender top tube, which lab department would this go to for processing? Option A, microbiology. Option B, hematology. Option C, coagulation. Option D, chemistry. The correct answer is option B, hematology. Explanation. A complete blood count with differential evaluates blood cells, so the specimen is processed in hematology rather than chemistry, microbiology, or coagulation. Question 47. The correct lead from the right arm to the leg is Option A, augmented voltage right arm lead. Option B, augmented voltage foot lead. Option C, lead 3. Option D, lead 2. The correct answer is option D, lead 2. Explanation. Standard limb lead 2 records the electrical potential from the negative right arm electrode toward the positive left leg electrode. Question 48. No anticoagulants are found in which of the following tubes? Option A, green-topped. Option B, yellow-topped. Option C, lavender-topped. Option D, red-topped. The correct answer is option D, red-topped. Explanation. A plain red-topped tube traditionally contains no anticoagulant, allowing the blood to clot so serum can be separated after centrifugation. Question 49. Which of the following is not true regarding Health Insurance Portability and Accountability Act laws? Option A. Patients can make informed choices regarding how their personal health information is used. Option B. Few boundaries are set on the use and release of health records. Option C. Patients have more control over their medical records. Option D. Violators are held accountable if patient privacy rights are compromised. The correct answer is option B. Few boundaries are set on the use and release of health records. Explanation. The statement that few boundaries exist is false because the Health Insurance Portability and Accountability Act privacy rule places important limits on how protected health information may be used and disclosed. Question 50. The invoice for the monthly rent of the building where the medical office is located, is typically handled by which department? Option A, compliance. Option B, human resources. Option C, accounts payable. Option D, accounts receivable. The correct answer is option C, accounts payable. Explanation. Accounts payable handles money the medical office owes to others, such as rent, utilities, and vendor invoices. Question 51. Cellular respiration is a function of the Option A, cell membrane. Option B, mitochondria. Option C, Golgi apparatus. Option D, nucleus. The correct answer is option B, mitochondria. Explanation. Mitochondria generate most cellular energy through aerobic cellular respiration, which is why they are often called the energy-producing structures of the cell. Question 52. How many electrodes are used as part of a 12-lead electrocardiogram? Option A, 10. Option B, 6. Option C, 12. Option D, 8. The correct answer is option A, 10. Explanation. A standard 12-lead electrocardiogram uses 10 electrodes to generate 12 electrical views of the heart. Question 53. What does this symbol represent? Option A, chemical hazard. Option B, biologic hazard. Option C, radioactive hazard. Option D, Sharp's hazard. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 54. A 67-year-old man comes into the doctor's office for a regular checkup. The doctor orders an electrocardiography to be done on the patient. There is junctional escape beat noticed by you. What is the origin of this rhythm? Option A, atrioventricular node. Option B, bundle branches. Option C, ventricle. Option D, sinus node. The correct answer is option A, atrioventricular node. Explanation. A junctional escape beat originates in tissue near the atrioventricular junction when the normal pacemaker fails to fire or its impulse does not reach the ventricles. Question 55. Protected health information stands for Option A, protected health information. Option B, private health instructions. Option C, private health information. Option D, protected health instructions. The correct answer is option A, protected health information. Explanation. Protected health information is individually identifiable health information that is protected by privacy rules when handled by covered healthcare organizations and their business associates. Question 56. Collection devices used in skin punctures are called Option A, capillary tubes. Option B, butterfly sets. Option C, blood culture collection systems. Option D, 25-gauge needles. The correct answer is option A, capillary tubes. Explanation. Capillary tubes are designed to collect small blood samples obtained by skin puncture, such as from a finger or heel. Question 57. When the body has had adequate rest and no food for at least 12 hours, it is said to be in Option A, hemostasis. Option B, basal state. Option C, homeostasis. Option D, steady state. The correct answer is option B, basal state. Explanation. Basal state describes the body after adequate rest and fasting, when metabolic activity is measured under relatively standardized resting conditions. Question 58. Which of the following is an example of negative kinesics? Option A, smiling. Option B, eye contact. Option C, frowning. Option D, good grooming. The correct answer is option C, frowning. Explanation. Kinesics refers to body movement and nonverbal expression. Frowning communicates a negative nonverbal message. Question 59. What drug enhances the effects of another drug? Option A, narcotic. Option B, antagonist. Option C, trade. Option D, synergistic. The correct answer is option D, synergistic. Explanation. A synergistic drug interaction occurs when one drug increases or enhances the effect of another drug. Question 60. The layer of the heart that is responsible for contraction and relaxation is known as the Option A, pericardium. Option B, myocardium. Option C, endocardium. Option D, epicardium. The correct answer is option B, myocardium. Explanation. The myocardium is the thick muscular middle layer of the heart wall and generates the force needed for cardiac contraction. Question 61. The physician prescribes a buccal medication. The medical assistant should instruct the patient to Option A, place the medication between the lower teeth and cheek. Option B, chew the medication and swallow it. Option C, place the medication under the tongue. Option D, dissolve the medication in water and drink it. The correct answer is option A, place the medication between the lower teeth and cheek. Explanation. A buccal medication is designed to dissolve between the cheek and gum so the drug can be absorbed through the lining of the mouth. Question 62. Which of the following is correct for ending a venipuncture procedure? Option A, remove the tourniquet, remove the needle, remove the tube, apply pressure. Option B, remove the tourniquet, remove the tube, remove the needle, apply pressure. Option C, remove the needle, remove the tube, remove the tourniquet, apply pressure. Option D, remove the tube, remove the tourniquet, remove the needle, apply pressure. The correct answer is option B, remove the tourniquet, remove the tube, remove the needle, apply pressure. Explanation. Releasing the tourniquet and removing the collection tube before withdrawing the needle reduces venous pressure and helps end the draw safely before pressure is applied. Question 63. Which of the following precautions require special air handling and ventilation? Option A, contact precautions. Option B, standard precautions. Option C, airborne precautions. Option D, droplet precautions. The correct answer is option C, airborne precautions. Explanation. Airborne precautions require special ventilation because very small infectious particles can remain suspended in the air and travel beyond the immediate patient area. Question 64. The ability to identify with someone else's feelings is called option A, respect. Option B, feedback. Option C, sympathy. Option D, empathy. The correct answer is option D, empathy. Explanation. Empathy is the ability to understand and identify with another person's feelings while maintaining an appropriate professional perspective. Question 65. The principal advantage of using wave method when designing the scheduling process is that it, option A, provides more breaks for staff. Option B, allows flexibility to accommodate the unpredictable. Option C, gives priority to established patients. Option D, enables the physician to see more patients each day. The correct answer is option B, allows flexibility to accommodate the unpredictable. Explanation. Wave scheduling builds flexibility into the schedule by grouping several patients near the same time so the office can absorb delays, variable visit lengths, and unexpected events. Question 66. Demerol 75 mg, intramuscular every 4 hours, as needed for severe pain, is what type of medication order? Option A, single. Option B, as needed. Option C, immediate. Option D, routine. The correct answer is option B, as needed. Explanation. The phrase as needed means the medication is given only when the patient meets the stated need, so this is an as needed medication order rather than a routine or one-time order. Question 67. Is usually sponsored and partially paid by an employer. Option A, TRICARE. Option B, private insurance. Option C, workers' aid. Option D, group health insurance. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 68. Which of the following blood pressure readings would be considered stage 1 hypertension? Option A, 148/96. Option B, 116/72. Option C, 126/84. Option D, 178/104. The correct answer is option A, 148/96. Explanation. The source classifies 148/96 as stage 1 hypertension. Blood pressure categories can vary by guideline and era, so use the classification system required by the course. Question 69. Coinsurance is calculated based on A. Option A, a capitation rate. Option B, percentage of charge. Option C, a fixed charge for each visit. Option D, number of policyholders in the plan. The correct answer is option B, percentage of charge. Explanation. Coinsurance is the portion of an allowed charge that the insured person pays as a percentage after applicable plan rules are met. Question 70. The primary purpose of wearing gloves during phlebotomy procedures is to protect the option A, venipuncture site from contamination by the phlebotomist's hands. Option B, specimen from contamination by the phlebotomist. Option C, patient from contamination by the phlebotomist. Option D, phlebotomist from exposure to the patient's blood. The correct answer is option D, phlebotomist from exposure to the patient's blood. Explanation. Gloves provide a barrier that reduces the phlebotomist's direct skin exposure to the patient's blood and other potentially infectious material. Question 71. What is the function of the large intestine, also known as colon? Option A, absorb water. Option B, absorb sugar. Option C, absorb fat. Option D, absorb vitamins. The correct answer is option A, absorb water. Explanation. The large intestine absorbs water and electrolytes from intestinal contents and helps form and store feces. Question 72. Which of the following tests is not a part of complete blood count? Option A, activated partial thromboplastin time. Option B, differential. Option C, hemoglobin. Option D, hematocrit. The correct answer is option A, activated partial thromboplastin time. Explanation. Activated partial thromboplastin time is a coagulation test, not a component of the complete blood count, which evaluates blood cells and related indices. Question 73. Which of the following specimens are best utilized to measure clotting factors? Option A, serum. Option B, whole blood. Option C, plasma. Option D, sterile blood. The correct answer is option C, plasma. Explanation. Plasma is used for many clotting factor tests because the specimen retains clotting proteins when blood is collected with the correct anticoagulant. Question 74. The boundaries for the approved area in performing heel punctures are: Option A, the line extending from the third toe, dividing the plantar surface into medial and lateral aspects. Option B, the line extending from the third and fourth toe, dividing the plantar surface. Option C, the lateral line extending from the third toe and the medial line extending from the second toe. Option D, the medial line extending from the great toe and lateral line extending from the fourth and fifth digit. The correct answer is option D, the medial line extending from the great toe and lateral line extending from the fourth and fifth digit. Explanation. Heel punctures are limited to the approved medial and lateral plantar areas to reduce the chance of injuring the heel bone, nerves, and vessels. Question 75. How do you know when you have achieved adequate ventilation for a patient when doing cardiopulmonary resuscitation? Option A, air escapes the nose. Option B, air enters the stomach. Option C, rise of the chest. Option D, you hear a popping sound. The correct answer is option C, rise of the chest. Explanation. Visible chest rise shows that enough air is entering the lungs to expand the chest during rescue ventilation. Question 76. Hypotension is defined as: Option A, no measurable systolic pressure. Option B, systolic pressure above 150 mm of mercury and diastolic pressure above 90 mm of mercury. Option C, systolic pressure of 129 mm of mercury and diastolic pressure of 80 mm of mercury. Option D, systolic pressure below 90 and diastolic pressure below 60 mm of mercury. The correct answer is option D, systolic pressure below 90 and diastolic pressure below 60 mm of mercury. Explanation. The source defines hypotension as a systolic pressure below 90 and a diastolic pressure below 60 mm of mercury. Clinical interpretation also depends on symptoms and the patient's baseline. Question 77. Which body system has the liver, gallbladder, and pancreas as accessory organs? Option A, digestive. Option B, endocrine. Option C, integumentary. Option D, lymphatic. The correct answer is option A, digestive. Explanation. The liver, gallbladder, and pancreas are accessory organs of digestion because they produce, store, or deliver substances that help digest food. Question 78. The body organ targeted by hepatitis B virus is the: Option A, brain. Option B, liver. Option C, heart. Option D, lungs. The correct answer is option B, liver. Explanation. Hepatitis B virus primarily infects liver cells, so the liver is the main organ affected by the disease. Question 79. A phlebotomist enters a room to draw blood on a patient who is hospitalized with an infected wound. The site of the wound and any of its bandages are considered which link in the chain of infection? Option A, portal of exit. Option B, susceptible host. Option C, infectious agent. Option D, mode of transmission. The correct answer is option A, portal of exit. Explanation. An infected wound can release microorganisms into the environment, making the wound and contaminated drainage or dressings a portal of exit in the chain of infection. Question 80. The normal volume of urine produced by an adult in a 24-hour period generally does not exceed: Option A, 2,000 liters. Option B, 2,000 milliliters. Option C, 400 milliliters. Option D, 750 milliliters. The correct answer is option B, 2,000 milliliters. Explanation. The source uses about 2,000 milliliters as the upper end of typical daily adult urine output, although normal output varies with intake and clinical condition. Question 81. When using a ventrogluteal approach to give an intramuscular injection in the buttock area, what is the muscle the medication goes in? Option A, gluteus maximus. Option B, gluteus medius. Option C, right upper and outer quadrant. Option D, gluteus minimus. The correct answer is option B, gluteus medius. Explanation. The ventrogluteal intramuscular site overlays the gluteus medius and is selected because it provides a thick muscle mass away from major nerves and blood vessels. Question 82. Mr. Matthews called the office to get the test results for his wife, Martha. What should the medical assistant do? Option A, tell Mr. Matthews that you cannot release the information. Option B, check the medical record to see if Mr. Matthews is really Martha's husband, if so then release the information. Option C, tell Mr. Matthews the test results. Option D, check the medical record to see if Mr. Matthews is authorized to have this information on Mrs. Matthews' Health Insurance Portability and Accountability Act form. If so, then release the information. The correct answer is option D, check the medical record to see if Mr. Matthews is authorized to have this information on Mrs. Matthews' Health Insurance Portability and Accountability Act form. If so, then release the information. Explanation. Test results may be released to a spouse only when the patient has authorized that disclosure or another valid legal basis exists, so the medical record must be checked before information is shared. Question 83. The medical assistant was sent to the ward to draw blood for coagulation studies. Which of the following is correct about this draw? Option A, the medical assistant can use capillary tubes for the blood collection. Option B, draw a red top tube before the light blue tube. Option C, fill a light blue to the top. Option D, before drawing the specimen, make sure the patient has fasted for 12 hours. The correct answer is option D, before drawing the specimen, make sure the patient has fasted for 12 hours. Explanation. The source keys a 12-hour fast before coagulation studies, but fasting is not generally the defining requirement for routine coagulation collection. This item should be verified against the course source before use. Question 84. Defamation through spoken statements is known as Option A, libel. Option B, sympathy. Option C, empathy. Option D, slander. The correct answer is option D, slander. Explanation. Slander is defamation communicated through spoken words, while libel generally refers to defamation in written or recorded form. Question 85. Issues relating to medical advances come under the heading of Option A, malfeasance. Option B, religious freedom. Option C, bioethics. Option D, ethics. The correct answer is option C, bioethics. Explanation. Bioethics applies ethical principles to questions created by medicine, biology, healthcare technology, research, and advances in treatment. Question 86. Normal sinus rhythm has a heart rate of beats per minute. Option A, 80 to 120. Option B, 50 to 75. Option C, 60 to 100. Option D, 40 to 60. The correct answer is option C, 60 to 100. Explanation. Normal sinus rhythm is commonly defined as a regular sinus rhythm with a rate from 60 to 100 beats per minute in an adult. Question 87. The term used to describe sophisticated and highly complex care is Option A, managed care. Option B, tertiary care. Option C, secondary care. Option D, primary care. The correct answer is option B, tertiary care. Explanation. Tertiary care is highly specialized, complex care that often involves advanced technology and subspecialty expertise. Question 88. A 45-year-old man comes in for a stress test. His resting blood pressure is 120/80. During the stress test, his blood pressure dropped to 95/55 and his skin is cold and clammy. What is the best course of action? Option A, stop for a minute, then resume. Option B, stop the test immediately. Option C, slow the test and then pick the pace back up. Option D, push forward with the test. The correct answer is option B, stop the test immediately. Explanation. A major blood pressure drop with cold, clammy skin during a stress test suggests poor tolerance and possible circulatory compromise, so the test should be stopped immediately for patient safety. Question 89. A pounding or racing of the heart, such that the patient is aware of his and her heartbeat, is called a and an. Option A, palpitation. Option B, ectopic beat. Option C, hemoptysis. Option D, arrhythmia. The correct answer is option A, palpitation. Explanation. A palpitation is the sensation of being aware of a forceful, rapid, irregular, or pounding heartbeat. Question 90. During assessment, the best source from which to obtain patient information is the Option A, the medical record. Option B, physician's notes. Option C, a family member. Option D, the physician. The correct answer is option A, the medical record. Explanation. The medical record is the organized source of documented patient information, including history, medications, allergies, prior findings, and treatment information. Question 91. If a laboratory test requires serum, which vacutainer tube is the tube of choice? Option A, lavender top tubes. Option B, black top tubes. Option C, yellow top tubes. Option D, red top tubes. The correct answer is option D, red top tubes. Explanation. A red top tube allows blood to clot so serum can be separated, making it appropriate for tests that require serum. Question 92. Tachycardia is a pathology that damages mainly the Option A, heart muscle. Option B, brain. Option C, blood vessels. Option D, body organs. The correct answer is option A, heart muscle. Explanation. The source key's heart muscle. Tachycardia means an abnormally fast heart rate and can increase cardiac workload, but the wording that it directly damages one organ should be reviewed for accuracy. Question 93. The three kinds of blood cells are: Option A, leukocytes, red blood cells, erythrocytes. Option B, erythrocytes, platelets, thrombocytes. Option C, leukocytes, white blood cells, platelets. Option D, erythrocytes, thrombocytes, leukocytes. The correct answer is option D, erythrocytes, thrombocytes, leukocytes. Explanation. The three major formed elements of blood are erythrocytes, leukocytes, and thrombocytes, which are red blood cells, white blood cells, and platelets. Question 94. Which of the following is correct regarding contact transmissions? Option A, it involves the transfer of pathogens by food and water. Option B, it involves contaminated instruments, needles, or contaminated hands that are not washed. Option C, it involves transmission of pathogens that remain suspended in air for a long period of time. Option D, it refers to the transfer of pathogens by mosquitoes, flies, and rats. The correct answer is option B. It involves contaminated instruments, needles, or contaminated hands that are not washed. Explanation. Indirect contact transmission can occur when pathogens are transferred by contaminated instruments, surfaces, or hands that have not been properly cleaned. Question 95. Which of the following requires all employees workplace hazard training? Option A, standard precautions. Option B, bloodborne pathogen. Option C, emergency action plans. Option D, hazard communication standard. The correct answer is option D, hazard communication standard. Explanation. The hazard communication standard requires employers to provide information and training about hazardous chemicals that employees may encounter in the workplace. Question 96. The mental and emotional condition, enthusiasm, loyalty, or confidence of an individual or group with regard to function or tasks at hand is called: Option A, morale. Option B, insubordination. Option C, initiative. Option D, tenacity. The correct answer is option A, morale. Explanation. Morale describes the confidence, enthusiasm, and emotional outlook of an individual or group toward its work and responsibilities. Question 97. What specimens require protection from light? Option A, bilirubin. Option B, lactic acid. Option C, blood gases. Option D, cryofibrinogens. The correct answer is option A, bilirubin. Explanation. Bilirubin breaks down when exposed to light, so specimens for bilirubin testing are protected from light to help preserve an accurate result. Question 98. Veterans with service-related disabilities are eligible for care under which of the following programs? Option A, TRICARE. Option B, VetServe. Option C, Civilian Health and Medical Program of the Department of Veterans Affairs. Option D, ChampAid. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 99. There are two types of civil actions healthcare providers for injuries resulting from healthcare. The first one is lack of informed consent and the second one is: Option A, violation of standard of care. Option B, trial and post-trial. Option C, violation of confidentiality. Option D, violation of continued care plan. The correct answer is option A, violation of standard of care. Explanation. A violation of the standard of care occurs when a healthcare provider fails to act with the level of skill and care expected under similar circumstances. Question 100. Two employees discussing a patient diagnosis on a hospital elevator with other people present is a violation of: Option A, patient rights. Option B, patient privacy. Option C, patient confidentiality. Option D, patient insurance. The correct answer is option C, patient confidentiality. Explanation. Discussing a patient's diagnosis where unauthorized people can hear it exposes confidential health information and violates the duty to protect patient confidentiality. Question 101. While taking a patient's medical history for active tuberculosis, what type of personal protective equipment is required? Option A, goggles. Option B, lab coat. Option C, gloves. Option D, mask. The correct answer is option D, mask. Explanation. Active tuberculosis is spread through airborne particles, so respiratory protection is required when entering or interviewing a patient with suspected or confirmed infectious tuberculosis. Question 102. Choose the answer that corresponds with letter F. Option A, basilic vein. Option B, medicancubital vein. Option C, radial artery. Option D, cephalic vein. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 103. When performing a dermal puncture and the lancet hits the bone, what is the potentially serious fatal bone infection that could occur? Option A, osteochondritis. Option B, osteomyelitis. Option C, osteomalacia. Option D, osteoporosis. The correct answer is option B, osteomyelitis. Explanation. Osteomyelitis is an infection of bone. A lancet that penetrates too deeply during a dermal puncture can potentially introduce infection near the bone. Question 104. How far above the site of draw is the tourniquet placed? Option A, 3-4 inches. Option B, 1-2 inches. Option C, 5-7 inches. Option D, 4-6 inches. The correct answer is option A, 3-4 inches. Explanation. Placing the tourniquet about 3 to 4 inches above the intended puncture site helps make the vein more prominent without obstructing access to the site. Question 105. Which agency regulates the Controlled Substances Act? Option A, Internal Revenue Service. Option B, Drug Enforcement Administration. Option C, Special Weapons and Tactics. Option D, Occupational Safety and Health Administration. The correct answer is option B, Drug Enforcement Administration. Explanation. The Drug Enforcement Administration enforces federal controlled substance laws and regulations, including requirements under the Controlled Substances Act. Question 106. One mental health illness that can hinder patient education is: Option A, chicken pox. Option B, high blood pressure. Option C, Alzheimer's disease. Option D, depression. The correct answer is option C, Alzheimer's disease. Explanation. Alzheimer's disease can impair memory, attention, comprehension, and learning, which can make patient education more difficult and may require adapted teaching methods. Question 107. A patient weighs 83.92 kilograms. How many pounds does he weigh? Option A, 185 pounds. Option B, 210 pounds. Option C, 200 pounds. Option D, 195 pounds. The correct answer is option A, 185 pounds. Explanation. Using the common conversion of about 2.2 pounds per kilogram, 83.92 kilograms is approximately 185 pounds. Question 108. What drug prevents the action of another drug or chemical? Option A, trade. Option B, narcotic. Option C, synergist. Option D, antagonist. The correct answer is option D, antagonist. Explanation. An antagonist blocks or reduces the action of another drug or chemical by opposing its effect at a receptor or through another mechanism. Question 109. Azithromycin. Option A is defined as the presence of chaotic cardiac activity. Option B produces a complete cessation of cardiac output. Option C is the most common primary event in cardiac arrest in the adult. Option D appears as a chaotic line on the electrocardiogram monitor. The correct answer is option B, produces a complete cessation of cardiac output. Explanation. Azithromycin means the absence of effective ventricular electrical activity and therefore no effective cardiac output. Question 110. Which of the following is known as swimmer's ear? Option A, otitis externa. Option B, otitis. Option C, otitis media. Option D, otitis interna. The correct answer is option A, otitis externa. Explanation. Otitis externa is inflammation or infection of the external ear canal and is commonly called swimmer's ear. Question 111. Thixotropic gel, found in the serum separator tube, red gray marbled topped vacutainer tube. Option A is more dense than red blood cells and less dense than white blood cells. Option B, is more dense than red blood cells and less dense than serum. Option C, is less dense than red blood cells but more dense than serum. Option D, has the same density as red blood cells. The correct answer is option C, is less dense than red blood cells but more dense than serum. Explanation. During centrifugation, separator gel moves between the denser blood cells and the less dense serum, creating a stable physical barrier between them. Question 112. A normal resting heart rate for the average adult is: Option A, 15-20 beats per minute. Option B, 80-120 beats per minute. Option C, 10-15 beats per minute. Option D, 60-100 beats per minute. The correct answer is option D, 60-100 beats per minute. Explanation. A normal resting adult heart rate is commonly taught as 60 to 100 beats per minute, with individual variation based on age, fitness, medications, and health status. Question 113. When medical assistants are able to adapt to various situations, they are considered to be: Option A, courteous. Option B, flexible. Option C, dependable. Option D, loyal. The correct answer is option B, flexible. Explanation. Flexibility is the ability to adjust behavior or plans when circumstances change, which is important in a busy medical office. Question 114. When a blood pressure cuff is deflated, the first tapping sound is the pressure. Option A, pulse. Option B, systolic. Option C, mean arterial. Option D, diastolic. The correct answer is option B, systolic. Explanation. The first Korokov sound heard while the cuff pressure falls marks the systolic pressure, which reflects arterial pressure during ventricular contraction. Question 115. Postprandial means: Option A, before a meal. Option B, before bedtime. Option C, fasting. Option D, after a meal. The correct answer is option D, after a meal. Explanation. Postprandial means after a meal, so a postprandial measurement or instruction is timed after eating. Question 116. The patient has been given a prescription that says the medication should be taken twice daily. This medication should be taken: Option A, before bedtime. Option B, once a day. Option C, before meals. Option D, twice a day. The correct answer is option D, twice a day. Explanation. Twice daily means the medication is taken 2 times during the day at the intervals directed by the prescriber. Question 117. Another term for outpatient care is: Option A, rehabilitation care. Option B, non-ambulatory care. Option C, ambulatory care. Option D, nursing home care. The correct answer is option C, ambulatory care. Explanation. Ambulatory care means healthcare provided without an overnight hospital admission, so it is another term for outpatient care. Question 118. The patient information sheet contains: Option A, the past medical history of the patient. Option B, the patient's past family history. Option C, the patient's chief complaint. Option D, patient's personal and insurance information. The correct answer is option D, patient's personal and insurance information. Explanation. The patient information sheet is used to collect identifying, contact, and insurance information needed for registration, billing, and communication. Question 119. The patient's specimen is lipemic. This is usually an indicator that the patient is: Option A, smoking. Option B, not fasting. Option C, normal. Option D, in basal state. The correct answer is option B, not fasting. Explanation. Lipemia makes serum or plasma look cloudy or milky because of excess circulating lipids and can occur when a patient has not fasted before collection. Question 120. Sodium citrate is the additive in what color tube? Option A, red. Option B, green. Option C, light blue. Option D, lavender. The correct answer is option C, light blue. Explanation. Light blue tubes contain sodium citrate, an anticoagulant used primarily for coagulation testing because it binds calcium in a controlled ratio. Question 121. Which of the following is an example of proxemics? Option A, eye contact. Option B, facial expression. Option C, personal contact. Option D, personal hygiene. The correct answer is option B, facial expression. Explanation. The source keys facial expression, but proxemics concerns the use of personal space and physical distance in communication. This item should be reviewed because the supplied key appears inconsistent with standard terminology. Question 122. The information of blood cells is defined as: Option A, hematopoiesis. Option B, erythropoietin. Option C, mean corpuscular volume. Option D, hemoglobinopathy. The correct answer is option A, hematopoiesis. Explanation. Hematopoiesis is the process by which blood cells are formed and developed, mainly in the bone marrow after birth. Question 123. A round, raised skin lesion with itching that is a positive sign of reaction to allergic testing is A. Option A, wheal. Option B, nodule. Option C, papule. Option D, vesicle. The correct answer is option C, papule. Explanation. The source key's papule, but allergy skin testing is commonly described as positive when a wheal develops. This item should be reviewed because the supplied key and standard terminology may not agree. Question 124. Choose the answer that corresponds with letter A. Option A, cephalic vein. Option B, radial artery. Option C, ulnar artery. Option D, brachial artery. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 125. Which of the following are also referred to as serum separator tubes? Serum separator tube. Option A, red and gray top tubes. Option B, red top tubes. Option C, light blue top tubes. Option D, lavender top tubes. The correct answer is option A, red and gray top tubes. Explanation. Red and gray marbled tubes are serum separator tubes because they contain a gel barrier that separates serum from blood cells after centrifugation. Question 126. Choose the answer that corresponds with number D. Option A, ulnar artery. Option B, radial artery. Option C, brachial artery. Option D, cephalic vein. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 127. A patient is having a seizure. Which of the following is the most appropriate step for the medical assistant to take to protect the patient? Option A, raise the patient's feet. Option B, call for help. Option C, loosen clothing around the patient's neck. Option D, administer small amounts of liquid. The correct answer is option C, loosen clothing around the patient's neck. Explanation. Loosening tight clothing around the neck can help protect breathing during a seizure. The patient should also be protected from injury and nothing should be placed in the mouth. Question 128. Somatic tremor is the result of option A, muscle movement. Option B, loose sensors. Option C, unequal amounts of electrolytes. Option D, improper standardization of the instrument. The correct answer is option A, muscle movement. Explanation. Somatic tremor is an electrocardiogram artifact caused by skeletal muscle movement, such as shivering, tension, or patient motion during the recording. Question 129. Important information a patient should know about immunizations would be that option A, they are not necessary if quality infection is maintained. Option B, they are prophylactics against deadly diseases. Option C, they are known to cause autism. Option D, they can unintentionally give the recipient a disease. The correct answer is option B. They are prophylactics against deadly diseases. Explanation. Immunizations are preventive measures that prepare the immune system to respond to specific infectious diseases before exposure causes serious illness. Question 130. Your patient is experiencing chest pain and has a heart rate of 132 beats per minute. You attach the electrocardiogram monitor and see a fast, regular rhythm with a round upright P wave that precedes each QRS complex. The QRS complexes are 0.1 seconds in duration. This patient is experiencing option A, junctional escape rhythm. Option B, sinus tachycardia. Option C, complete atrioventricular heart block. Option D, idioventricular rhythm. The correct answer is option B, sinus tachycardia. Explanation. A fast regular rhythm with a normal upright P wave before every narrow QRS complex is characteristic of sinus tachycardia because the rhythm is still originating from the sinus node. Question 131. The insurance carrier is allowed to use any method to determine the amount for a service, also known as the option A, fee schedule. Option B, deductible. Option C, allowed amount. Option D, insurance premium. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 132. Samples appear to have been mislabeled and mixed on 2 patients. Each outpatient has orders for both blood and urine test, so there were 2 samples for each. What would be the best course of action? Option A, recollect all 4 specimens from the patients. Option B, relabel the urine samples, but redraw the blood. Option C, have the patients come back and identify their specimens. Option D, relabel all the specimens. The correct answer is option A, recollect all 4 specimens from the patients. Explanation. When patient specimens may be mislabeled, the safest action is to reject the questionable specimens and recollect them using correct identification procedures rather than guess which sample belongs to whom. Question 133. Verbal facial expressions or body language, such as a nod of understanding, are called option A, external noise, option B, internal noise, option C, channels, option D, feedback. The correct answer is option D, feedback. Explanation. Feedback is the receiver's response that shows whether a message was understood, and it can be verbal or nonverbal, such as a nod. Question 134. Without a clot activator, whole blood typically clots in minutes. Option A, 60 to 20. Option B, 1 to 2. Option C, 30 to 60. Option D, 5 to 10. The correct answer is option C, 30 to 60. Explanation. Without a clot activator, blood in a plain collection tube may require about 30 to 60 minutes to clot completely before centrifugation. Question 135. Information given by a patient to medical personnel that cannot be disclosed without consent constitutes option A, duty of care, option B, negligence, option C, judgment, option D, privileged communication. The correct answer is option D, privileged communication. Explanation. Privileged communication is confidential information shared within a protected professional relationship and is not normally disclosed without authorization or another lawful basis. Question 136. A quantitative test is one that option A, tests for the presence and amount of substance in sample, option B, tests for presence of substance only, option C, does not require a trained technician, option D, tests for all substances found in the sample. The correct answer is option A, tests for the presence and amount of substance in sample. Explanation. A quantitative test reports how much of a substance is present, while a qualitative test generally reports whether the substance is present or absent. Question 137. Choose the answer that corresponds with number E. Option A, basilic vein, option B, radial artery, option C, cephalic vein, option D, median cubital vein. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 138. A patient's weight should be listed in the patient's chart to the nearest. Option A, pound, option B, 1/2 pound, option C, ounce, option D, 1/4 pound. The correct answer is option D, 1/4 pound. Explanation. The source keys 1/4 pound as the charting precision. This is a documentation convention from the source and should be matched to the policy or equipment standard used in the course. Question 139. Identify the tubes needed to collect a prothrombin time, immediate electrolytes, and blood culture in the proper order of collection. Option A, yellow, light blue, plasma separator tube. Option B, serum separator tube, yellow, light blue. Option C, light blue, lavender, yellow. Option D, gold, yellow, light blue. The correct answer is option A, yellow, light blue, plasma separator tube. Explanation. The keyed sequence places the blood culture collection first, followed by the light blue coagulation tube and then the plasma separator tube for electrolytes. Question 140. Before developing a medication schedule, you should evaluate the patient's option A, bathroom habits, option B, medical record, option C, daily routine, option D, side effects. The correct answer is option C, daily routine. Explanation. A medication schedule is more likely to be followed when it fits the patient's normal daily routine, such as waking, meals, work, and bedtime. Question 141. The primary function of the nervous system is option A, to protect deep organs, option B, to cleanse the blood of pathogens, option C, to detect changes in the internal and external environment and respond appropriately, option D, to provide body support and levers for muscle action. The correct answer is option C, to detect changes in the internal and external environment and respond appropriately. Explanation. The nervous system senses changes inside and outside the body, processes that information, and coordinates an appropriate response. Question 142. The Q wave, if present, is always option A, positive, option B, present, option C, isoelectric, option D, negative. The correct answer is option D, negative. Explanation. A normal Q wave, when present, is the first negative deflection of the Q or S complex before the first positive R wave. Question 143. What is the best sample for the determination of blood pH and blood gases? Option A, cerebrospinal fluid. Option B, arterial blood. Option C, venous blood. Option D, capillary blood. The correct answer is option B, arterial blood. Explanation. Arterial blood is preferred for blood gas testing because it best reflects oxygenation, ventilation, and acid-base status after gas exchange in the lungs. Question 144. After a patient interview by the medical assistant, which of the following should not be recorded by the medical assistant? Option A, family medical history. Option B, examination narrative. Option C, chief complaint. Option D, medication allergies. The correct answer is option B, examination narrative. Explanation. The medical assistant may document information obtained during the interview, but the provider's examination narrative belongs to the provider's clinical examination and should not be independently created by the assistant. Question 145. Two premature ventricular complexes. Premature ventricular complexes in a row are called A and N of premature ventricular complexes. Option A, deuce. Option B, couplet. Option C, bijgminy. Option D, double. The correct answer is option B, couplet. Explanation. Two premature ventricular complexes occurring consecutively are called a couplet. Question 146. Which of the patient's limbs serves as an electrical ground? Option A, right arm. Option B, left leg. Option C, left arm. Option D, right leg. The correct answer is option D, right leg. Explanation. In a standard electrocardiogram setup, the right leg electrode serves as the reference or ground electrode and is not used to form the main diagnostic limb leads. Question 147. The patient's chart indicates a urine sample was collected at 1,800. This means the sample was collected at option A, 8 inches the morning. Option B, 8 inches the evening. Option C, 6 inches the morning. Option D, 6 inches the evening. The correct answer is option D, 6 inches the evening. Explanation. Military time 1,800 corresponds to 6 inches the evening because times after noon are converted by subtracting 12 from the hour number. Question 148. This is federal program that provides medical care for the indigent. Option A, Public Health Service. Option B, Medicaid. Option C, Medicare. Option D, Health Insurance Portability and Accountability Act. The correct answer is option B, Medicaid. Explanation. Medicaid is a joint federal and state program that provides health coverage to eligible people with limited income and other qualifying circumstances. Question 149. A 67-year-old man is diagnosed with atrial fibrillation and is treated with warfarin Coumadin. What is the characteristic of atrial fibrillation? Option A, sawtooth-shaped waves. Option B, P waves are absent. Option C, P waves with uniform shape. Option D, P waves of multiple shapes. The correct answer is option B, P waves are absent. Explanation. In atrial fibrillation, organized P waves are absent because atrial electrical activity is rapid and chaotic rather than produced by regular sinus node impulses. Question 150. A pulse site used to measure blood pressure is option A, brachial. Option B, popliteal. Option C, radial. Option D, temporal. The correct answer is option A, brachial. Explanation. The brachial artery is the standard pulse site used with a blood pressure cuff because the cuff is placed around the upper arm and the artery is assessed near the elbow crease. Question 151. When would a phlebotomist use a multiple sample needle? Option A, along family members who all require the same test. Option B, in a large outpatient laboratory for all patients requiring the same test. Option C, for microcapillary collection. Option D, when more than one tube of blood is to be collected. The correct answer is option D, when more than one tube of blood is to be collected. Explanation. A multiple sample needle allows several evacuated tubes to be filled during one venipuncture without removing the needle from the patient's vein. Question 152. You are the only medical assistant the night shift. You receive orders for all of the following tests within minutes of one another. Which test has the greatest collection priority? Option A, immediate complete blood count in labor and delivery. Option B, immediate electrolytes in the emergency room. Option C, timed blood cultures in intensive care unit. Option D, as soon as possible electrolytes in cardiac care unit. The correct answer is option B, immediate electrolytes in the emergency room. Explanation. An immediate electrolyte order from the emergency room has the highest stated urgency because the result may be needed rapidly for decisions about an acutely ill patient. Question 153. Choose the answer that corresponds with number C. Option A, radial artery. Option B, brachial artery. Option C, ulnar artery. Option D, cephalic vein. The correct answer is now shown. Explanation. The source does not include the referenced image or a keyed answer for this item, so the correct response cannot be supported from the supplied material alone. Question 154. The smallest structural unit of the nervous system is the Option A, spinal cord. Option B, neurofibrils. Option C, neuron. Option D, supine. The correct answer is Option C, neuron. Explanation. The neuron is the basic structural and functional cell of the nervous system because it receives, processes, and transmits nerve signals.